Well, good afternoon, parents of Clovis Unified. We're excited to have this opportunity to talk to you today. My name is Emer O'Farrell. I'm the superintendent here in Clovis Unified. And as you all know, just very recently, Clovis Unified submitted a waiver to the Department of Public Health here in Fresno County, a waiver that would enable us to open our elementary schools in grades TK through 6th grade. And also, as you know, last Friday, we sent home a survey to all of our parents, a survey that also contains a lot of information for our parents. It is our hope that all of our parents will be able to make informed decisions about what's best for your children. And in preparing to fill out that survey, we mentioned that we would be providing this opportunity today to speak with some of the specialists in our community. And so joined with us today, we have Dr. John Zweifler. Dr. Zweifler is the Assistant Medical Officer here in Fresno County. Also, Assistant Director David Lucchini from the Department of Public Health, and also Dr. Reyes Vora, our Interim Health Officer, again from our Fresno County Department of Public Health. So today's conversation is mostly focusing on the safety guidelines and the health guidelines that we have in place, but also, you know, parents, I'm sure you noticed from that survey information that we sent home that much of the information that you will need can be found on our website in our reopening plan, which is a very comprehensive document that we've provided for our parents and that we update very, very regularly. And also, if you have any specific questions about how your local school will handle things like pick-up and drop-off schedules and check-in health checks and things like that, please remind yourselves that we have 34 elementary schools and each school will have its own very specific plan, and they will be reaching out and providing the specifics about that school to the parent community of that school. And as I said, have often said before, our school principals are at the helm of each of those operations. So to start us off today, I just want to welcome also the Director of Nursing in Clovis Unified. Jeannie Prindini is also joining us, and she spends a lot of time in her role as our chief point person between Clovis Unified and the Department of Public Health. And so I just wanted to start off by asking our experts, how are we doing? What is the status of our waiver? And why is a waiver possible, available now? Why is it okay even to consider coming back to school under the guidelines of a waiver? And so I just posed that question to our experts, and it looks like Mr. Lucchini would like to respond to that.
Well, I don't know if I'm the expert. I never know if I'm the expert. I try to understand and memorize all these things coming from the feds and the state. So this is the best I know as of today, October 12th. But the waiver was put up from the, as an option back in August. The state allowed counties, if they were in the purple tier, remember we went with the new color tier from the state of California in August.
David, just hold on 1 second, because for some reason I'm not able to hear you, and we're just checking with our technical team to make sure I'm not the only person. Just 1 second while we double check on that. It's often technical issues. We think it's something on your end.
Testing?
Double check your
Testing?
Your capabilities.
You want me to log out real quick and come back in? Hold on, I'll chat it in.
One second. And so can Robin. Okay, David, keep going, and we'll figure out, because I cannot hear you, so we'll figure that part out.
Anybody hear me? Oh, Jeannie can hear me. Okay. So you heard the first part, Jeannie? Okay, so I won't repeat. So where I was at was the state created this color tier system where purple is the worst, then it goes red, then it goes orange, and then it goes yellow. So what they said in purple was the health officer could approve waivers from school districts just for elementary schools. So that would be from TK through 6th grade. And so, and the reason was they felt at the elementary school level, there was some students who were struggling around the state. And so they wanted to give the opportunity for schools to be able to open up partially to assist some of the students to get some in-person instruction, but once again, doing it very safely. So school districts have been applying for that waiver. We've had several schools approved, both private and public schools. I reviewed the Clovis Unified Plan, and we submitted to the state late last week. So we hope to hear something either today or tomorrow. I would say the state of California has been pretty quick in reviewing them. But it was just to give, once again, more options to allow for those who felt they needed to get some in-person classroom time. And once again, this is just for the elementary school. Now, while I'm talking about this, I might as well just also talk about that we've been in the red tier for the last couple of weeks. And if we get a red tier tomorrow, this will allow other grades, the secondary schools, middle school, and high schools to open once again with a lot of modifications. They will not have to do waivers, but there are expectations that they will follow the state and local guidelines on doing it very safely. We're probably going to look at doing attestation with the schools to just make sure that they attest to following the safety guidelines for the schools that will open. So tomorrow is a big day for a lot of the school districts to see if we remain in red, which will allow the middle schools and high schools to consider opening starting on Wednesday if we do get that red tier.
Thank you, David. I know that as our parents are filling out these surveys, we're receiving a lot of questions from parents about the isolation procedures for a student who may come to school, you know, with the sniffles, and which of course could be interpreted as a symptom of COVID. Can you talk to us a little bit about your recommendations for what to do in that case?
Dr. Zweifel, do you want to do the medical ones? Oh, you're on mute though. Hit that button. There we go.
All right, good. Okay, thank you, David and Dr. O'Farrell. And so this is a common question. So with COVID-19, the most common symptom is fever. So if you have a fever of 100.4, then that is certainly a cause for concern. But you can also have cough and shortness of breath. And that's generally why individuals get sick, is from the respiratory symptoms associated with COVID. But there's a host of other symptoms as well, including things like that are relatively common, including things like the sniffles, congestion, sore throat, headaches, nausea, vomiting, diarrhea, muscle aches are all considered, and fatigue are also classified by the Centers for Disease Control, the CDC, at the federal level, and also the California Department of Public Health, to be symptoms of COVID. What we've been working on with the schools is a twofold process. First of all, to do regular screening of all students prior to coming to school. And so it's nice to be able to speak to the parents, because the parents play a huge role in this. It's really important and up to you to work with your kids and to determine whether they have symptoms before they go to school, because it can have a huge impact on a lot of other people. So when they get to school, they'll be asked whether they have any of those symptoms and checked for a temperature. If you do have the symptoms, that doesn't mean you necessarily have COVID. So what we've done is, first of all, we want to be very cautious and careful, especially when we're opening. So if you have any of those symptoms, what we've worked with the schools is to say that anyone with symptoms should go home and isolate from others. But because this could also be symptoms of other types of diseases, what we've said is if you get a test for COVID and it comes back negative, then once your symptoms resolve, then you can return to school. So we're trying to both ensure that we're being very safe, protecting the health and safety of not only your children, but also of all the others that they come in contact with. At the same time, give us a chance so that when you do have symptoms that may end up not being COVID, that there is a mechanism for the children to return to school. And I know the schools are working very hard to make sure that there's access to online and virtual education if you do have to have to stay home for a few days. That's a key part of this whole educational strategy.
And I'll speak to that little piece in a moment, Dr. Zweifler. But one of the things that I noticed that parents, just even by looking at the questions here, parents are sometimes getting a little confused between having symptoms and then isolation, as opposed to being exposed and then having to quarantine. I've got that straight in my head, but I just want to make sure if you could take this moment to explain to parents the difference between having a symptom and being isolated, but being exposed, and what defines an exposure, and then how quarantine works.
Sure, no, that's a good and important question. So first of all, the isolation and quarantine both involve being away from others so that you don't infect others. However, isolation refers to if you actually have the disease or if you have the symptoms. So we say if you've been tested or positive for COVID or you have the symptoms, we say you should isolate. And the standard period for isolation is 10 days from the time that your symptoms begin, along with at least 1 day where you're free of symptoms and free of a fever. Or if you have a test and you didn't have symptoms, then it would be 10 days from the date that you had that test. And that's based on the time that the period of time that you're infectious. So you can spread the virus up to 10 days after being positive or when you start symptoms. So that's the basis for that isolation period. If you continue to have symptoms, then that period may have to be extended. Quarantine refers to individuals who may come in contact with someone who we know was positive or was infected with COVID. And the quarantine period lasts for 14 days. And it's a little bit counterintuitive because the quarantine period is actually longer than the isolation period. So, but that is based on the fact that if you're exposed to someone who has COVID, then that virus can take 2 to 14 days to develop an infection within you. So it's meant to make sure that you are staying away from others during this entire period where the virus could potentially be incubating inside of you. This can be particularly difficult if you happen to be a household contact, which is one of the most common ways that people are considered close contacts. So Dr. O'Farrell, you were asking about how do you define a close contact? We define a close contact as if you're within 6 feet for more than 15 minutes to someone who was infectious. And this is a cumulative amount of time. So if you're with someone for 5 minutes, then 5 more minutes at another time, that all counts. Here in Fresno County, we also say that you need to be, that the infectious person also needs to be unmasked. So the reason we include that is we really are trying to encourage people to wear their masks. So if you're wearing a mask, then that would also protect others. The other aspect of it is if you're a household contact, if you're living in the same household with someone who has COVID, then by definition we consider you a close contact as well. So it just drives home the point that it's a serious disease. If you're a close contact, it has serious implications. It means that for 14 days afterwards, you're expected to quarantine. So isolation and quarantine, they both refer to staying away from others to prevent the transmission. But isolation refers to if you have the disease yourself and lasts for 10 days. The quarantine refers to if you are a close contact and trying to stay away from others during the potential incubation period.
Okay, in a moment, I will talk to you about where families can go for COVID testing. But while you're thinking about that, I'd just like to mention, because I know a lot of parents are concerned about the fact that based on what you just said, Dr. Zweifler, there's a lot of potential for either a student or a teacher to need to isolate or quarantine depending on a wide range of factors. And I just want to remind all of our parents that prior to COVID ever occurring, when any of our students were out for sickness, we've always had an independent study program in place that has worked very effectively over the years, where we do everything we can to mitigate any learning loss. And of course, now we have so much technology available to us that students are obviously very intimately knowledgeable about, that we will be utilizing that technology moving forward, that if a student needed to isolate or to quarantine, we will work with that family to make sure that the student is not losing out on opportunities to be connected to the classroom, utilizing Google Classroom or even Zooming. So I just want to assure parents that just as we've always done, our goal is that our students miss out on as little as possible of their learning if they're actually not physically sick. And then also with regard to a teacher having to isolate or quarantine, we've been exploring ways for us that I think we're going to be very successful in making sure that that teacher can still be connected with their students during that period, again, using technology. So we're looking at ways as a district to mitigate any interruption to the learning. And we have a few ways that we can do that we're working our way through right now. In the meantime, though, we are getting a lot of questions from parents about where families can go for COVID testing if needed. And you know, teachers are wondering if a child in their class tests positive, you know, where are they getting that testing?
I can tackle that one as well. So Dr. Vora, the interim health officer who will be joining this call shortly, signed a health officer order on Friday that requires all primary care offices and urgent care centers in Fresno County to be able to provide COVID testing. So this is a big step, but it's an important one because we really want to ensure that there's access to COVID testing throughout our county. So we want to make sure that those who are on the front line of providing healthcare services and are the ones who usually take care of our residents who become sick, that each of them have the capability to test for COVID. So you've probably all seen the images of, and you may have even had one yourself, of getting the nasal swab, where you put this long swab into your nose and makes you cough, and it's not very pleasant. It's also a challenge for healthcare providers because it carries with it the risk of transmission of the virus. And so when you're using the nasal swabs, what's called nasopharyngeal swabs, the healthcare provider would need to be in what we call full personal protective equipment, full PPE. So they'd have to wear a gown and a mask and goggles as well as gloves. Well, fortunately, we've come a fairly long way in terms of COVID testing. So now we can get those tests with what's called an anterior nasal swab. So you as a patient can basically swab yourself and just kind of the anterior, the close part of the nose, while a healthcare provider watches you, but they don't need to have all that PPE on while you're doing that. So it makes it much more practical to offer this testing in each of these offices. And we've worked with a couple labs in the area to make sure that they can support our local healthcare providers. The Fresno County Department of Public Health is also working very closely with federally qualified health centers who are reaching out and providing additional testing in a number of markets. So we're confident that if you do become sick, that you will have access to COVID testing.
Okay, that's great. I know that our community will be very happy to hear that. And I know that our children will be very happy to hear that there's a better way to go about doing that. So that's good news for everybody. And I know that there have been a lot of, there's been a lot of talk about the colored tier system that the counties in California are kind of navigating through as we all try to get to the highest level of safety. There have been a number of questions about, like, at what point or in what tier will we need to be before it would be deemed safe to bring all of our students back into a normal school setting?
We feel, listening to the state of California Department of Public Health, that even in yellow, you're going to have some modifications to keep some distancing and masking and all that. So until the state really says we're back in the green, that's going to be, I would think, in several large counties. That's, I think, when we will see back to closer to normal, where you have all the students. I don't see it in any of the coasts at this time. Now, the state may change their directions, but currently, as I understand, we'll see some type of modification restrictions through the yellow.
And just to add to that, when we think about what can we do to prevent the spread of COVID, the two major techniques we have is, one, wear a mask, and the other is to socially distance, stay 6 feet apart. So the masking doesn't really impact the school, how a school runs as dramatically, but maintaining social distancing certainly does. And it's absolutely critical as we are bringing individuals together in groups, and especially indoors. So although as you go through the tiers, it is less prescriptive in terms of requirements on social distancing. We feel very strongly and have communicated with the schools that maintaining social distancing throughout the tiers is until we no longer have to deal with COVID-19. That social distancing is an absolutely essential component of our approach, and we recommend that it be maintained in all the different phases. So it has certainly impacts the way schools are run. But Dr. Farrell, you mentioned the strong kind of online presence that the schools already have, and the ability to have smaller class sizes, I think, also has some very potential benefits as well. But in terms of dealing with COVID-19, the masks and the social distancing are the two key steps that all of us can do, and will be with us through all the tiers.
Thank you, Dr. Waiver. And I know that many of our families are asking questions about our proposed AM/PM schedule. And here in Clovis Unified, we did have extensive conversations over the last few weeks in preparation for our submission of the elementary school waiver application with our teachers, and asking them, how do we best make sure that we can safeguard that 6 foot distancing in a standardized classroom. And so as we engage in those conversations with our elementary teachers, who are very, very possessive about their children, they love their students, it was very overwhelming that our teachers felt that they needed to have a contact with their students 5 days a week, as opposed to our students coming in person 2 days a week and being on their own, so to speak, for the other 3 days. And having those small groups of 12 to 15 students in person, situating them 6 feet apart with their masks, and then obviously having some very strict protocols in place in terms of entrance and egress, bathroom breaks, picking up their lunch, that kind of thing. And even having, while recess will look different and not necessarily be recess in the traditional sense of the word, but our teachers feel that our kids need a break, and have been looking into ways to do that would also adhere to the safety guidelines. So I know that many of our parents were asking about that. I just add another point to that, is that as our parents saw, one of the things that was suggested is that we have a Wednesday Zoom session for our students. And the main rationale behind that from our teachers, that came literally from our teachers, was that if you have students broken into track A and track B, that it was an opportunity for the students to all be together online on a Wednesday, maximize that limited time that we have on an early release day, and then also make sure that our students are keeping up with their Zoom skills. Because at any time, like you mentioned earlier, you know, a student or a teacher could have to isolate or quarantine. And that's not a time to be wondering how to turn the device on, or what was my password again, or my device isn't working, my internet isn't working. We want to make sure that our students maintain that connection with the online platform, so that if you know, we have a situation, I think we would all agree that it's when there is a situation somewhere in our district that it's an easy enough transition to an online for the duration of isolation or quarantine. And so many of our parents have been asking, you know, what was the rationale behind us putting that down as a part of the option. It also gives us an opportunity to host IEP meetings and 504 meetings, and also provides time for our teachers to plan. Planning has become more important than ever. Myself and my team meet with our principals regularly, and we had a meeting just this morning with one of our areas, and they talked about how important planning is right now with everybody, with the current situation. So this is why that was the option that we provided for our families. I also know that there have been a lot of questions about disinfecting and how we're, how we're providing that sanitized environment that I know our Department of Public Health asked us to articulate in detail in the application for the waiver. And I just want to draw attention to for our parents to the fact that last Friday, when we pushed out that survey, we also pushed out a lot of educational materials attached to that. And the goal there was so that parents could read our reopening plan. As I mentioned, it's been on our website for quite some time, and we update it at every time that we need to update it. But in there is a sheet that talks about what can I expect for the cleaning and disinfecting. It looks like this, and it talks about the foggers that we purchased with our CARES Act dollars so that we could deeply disinfect every classroom. And it talks about the actual details of Oxivir, which is the hydrogen peroxide-based disinfectant that we're using. It's EPA approved. It talks about how we're going to be cleaning our bathrooms and shared surfaces and shared materials. So parents, I just encourage our parents to look at this document in the program or in that plan that is referenced on the survey, and they're all the protocols, Dr. Waiver and Mr. Lucchini, that we referenced in our application for the waiver. I'm just looking to see if there are some more questions. We had some questions here about contact tracing. And I see our Director of Nursing, Jeannie Prandini, here on the call. And Jeannie oversees all of the nurses in Clovis Unified. And they've all had some very detailed training in contact tracing. Maybe, Jeannie, you might be able to comment on that for our parents.
Good afternoon. Yes, the Fresno County Department of Public Health, we have a great partnership with them, and they offered contact tracing for all our health services staff. So we were able to do that in August. It was a training that was modified for the school districts. Our main focus in the contact tracing is for our students and our staff and the close contacts that they may have in the school environment. Our contact tracing won't go into the household or their community contacts. We do have some new staff on board and others that want another refresher with it, and Fresno County Department of Public Health, under the guidance of Mary Morrison and Norma Sanchez, will be offering more to our district. But what it basically means is that when a person finds out that they're positive, there's their responsibility to, if they're a staff member, to let their supervisor know. And then also identify anybody that may be considered a close contact with them during the 48 hours prior to them having symptoms or prior to when they took a test and became positive. That way we're able to narrow in on the staff or employees or students that may have been involved with this. And the great thing is that if we all wear our masks and maintain our social distancing, we're not going to have any close contacts for anybody who does become positive. And also with our students, if our students are sent home with symptoms and it turns out that we do have a positive, we of course then will also then work with the parents in identifying any potential situations. But again, we're very, very committed to maintain the guidelines that the Fresno County Department of Public Health is stipulating for us, with the masking of both students and staff and maintaining those 6 feet distance. And then if we do need to break the 6 feet, that we're not in any period of time longer than the 15 minutes.
Well, thank you, Jeannie. And I just want to speak to the fact that, you know, we've been having students with Department of Public Health approved plans for many months now. We had our Campus Club program during the summer, and we've had students with special needs coming on campus, and those specialized services that we've been providing for small cohorts. And this contact tracing mechanism that Jeannie Prandini just explained just now has worked beautifully. I've witnessed us having somebody who contracted COVID and was positive due to some sort of outside contact, and for us to have been able to move swiftly. And because we have been very strict with our procedures and enforcing the mask wearing and enforcing the 6 foot distancing, we've really been able to mitigate disruption to other students and staff. So I just want to thank Jeannie Prandini and all our nurses, because they are very highly trained, and they are our point people between ourselves and the Department of Public Health on a regular daily basis as things will come up. Another item, I see Dr. Vora just joined us. Hi there, Dr. Vora. Another item that has come up is some of our parents have asked, you know, why are you asking us to make these decisions now? And one of the things, if they watched our board meeting the other night, you know, our teachers have gone above and beyond to build relationships with our students, and they've actually gone above and beyond to become very, very competent with regard to the online equipment. As one of our board members described it as a cockpit, it's like a cockpit of a 747. But even at that, we recognize that we want to, as much as possible, mitigate teacher changes, because we recognize that teacher-student relationship, that journey of learning that occurs during the school year, is very, very critical. And so for us, learning from our parents where their preferences lie and talking to our staff, we're trying to bring all those pieces of a very large puzzle to find a place where we can mitigate those teacher changes. And we are looking at trying some out-of-the-box ideas on a pilot basis at certain places right now, so that we can see what kind of innovative ideas we can put into place that will address that specific thing. The fact that pretty much every child, every student in our district does not want to change teachers. So it's a very challenging wish to make come true. But I do want our parents to know that we have some very out-of-the-box thinkers on our team who have come up with some great ideas. So stand by as we take all of the data that we're gleaning from our survey and trying to come up with solutions that we believe will help our students and our teachers and ultimately our parents feel happy. And as I'm looking at the questions, I see, especially as Dr. Vora has joined us. Welcome, Dr. Vora. I'm looking, there was a question here for you specifically. On Friday, there were reports that social gatherings are now okay, but should be limited to 3 households and under 2 hours. How are schools different is the question that we're being asked.
Yeah, great question. We're really glad that the state took the initiative to craft a guideline related to social gatherings. That's because previously they had said just don't have any social gatherings at all. And it's been that way for the last 6 months, ever since the shelter in place was first announced for the state of California. But we know that people are getting together for a lot of different reasons. Depending on the reason, those activities have had different guidances. Like, for example, a wedding or a religious ceremony like a funeral, there's guidances related to those because those are considered more religious ceremonies. Obviously, with essential occupations and other activities, there's guidance related to that. But for social gatherings, there was really nothing before this Friday guidance came out. And the state is now saying that, as long as you can have 3 households, use the physical distancing, use the masking, and do it outdoors if at all possible. To me, all of those are really good fundamental elements to a gathering that will keep everyone safe, and then to limit it for 2 hours. With schools, we understand that there's different needs and different resources available. And so with schools, we've been crafting this guidance, and I'm sorry I missed the start of this session, but I'm sure Drs. Weifler and David filled everyone in on how hard we've been working on all of the different issues related to schools coming back into session, and really thinking through what those scenarios need to look like. This gathering guidance is really not going to be applied to the school issues, because we've already got really good plans in place that we've already thought through. But the building blocks are the same. The fundamental issues related to decreasing and minimizing the risk of COVID transmission, protecting everyone whenever they're together, making sure that we're screening for ill people and making sure that they're not participating in the activities, that they actually have time to go recover by themselves at home. All of those actually are the common elements for every single thing that we plan for, whether it's an occupation, a religious ceremony, schools, social gatherings. Really, we apply the best known biology about this virus, and then we basically craft guidance related to that to make sure that we're trying to do things as safely as possible and yet permit as much as we can without overstepping into a more hazardous terrain.
Okay, and thank you, Dr. Bora. And we're getting some more questions. We may have had some parents join the session for further clarification around an issue that is very common in our schools, and that is allergies. Of course, being an agricultural valley, that's something we see every day.
Yes.
Sneezing, runny noses, that kind of thing. We're asking for further clarification on what parents should do if their child has one of those symptoms. I think there is some fear that if you were able to kind of diffuse a little bit, parents are concerned, am I going to need to keep my child home for 10 days when I know it's an allergy or I know it's a runny nose? So what further advice can you provide on that?
So in a nutshell, the answer is no, you won't need to if it's not related to coronavirus, especially if it's an allergic kind of symptomatology. Then I think our guidance has some language in there related to that. We just need to make sure, we know we're very sensitive that allergies can look a lot like some of the symptoms of coronavirus. However, insofar as they are distinct, for example, coronavirus is going to be associated, it's going to look more like a viral illness. It's going to be associated with low-grade fevers in many cases, just a general lethargy and decreased energy level, a lot of body aches, headaches, those sorts of things. Things that you don't see with just plain allergy symptoms. Beyond that, if you have a physician that you work with who can attest to the fact that, the child or the employee has allergies around this time of year every year, and it looks like this, and it responds very well to anti-allergy medicines, then obviously all of those are really good pieces of information that we should be considering so that we can make sure that, someone has done a thorough check, has made sure that this is indeed more seasonal allergies versus coronavirus, and then we can proceed from there. So yeah, definitely we want to make sure that we're not keeping people out that would otherwise be okay to come back just because of something like seasonal allergies. Kids, they may have, migraines, for example, or some other medical illnesses that can, flare up. Sometimes those symptoms, they can flare up and look like coronavirus. For example, some kids may have gastrointestinal issues that cause vomiting, migraines causing headaches. Again, if you have a medical professional, I have a relationship with this patient, this is just part of their normal kind of flare of their disease process. This is not coronavirus, I can attest to that. Then I think that would be very reassuring. And obviously we want that person to get better, so they may still need to stay home until they're better, but it wouldn't necessarily have to be 10 days. They could come back sooner as soon as they were improved, knowing that wasn't really coronavirus that kept them out. And I don't know if Eifler wants to add to those.
Yeah, if I could just add to that. So we were very sensitive to this issue. And so we added some language to say if they were new or worsening symptoms, to kind of help separate that from what are kind of consistent symptoms that you've had in the past. But we've also said that we just want to err on the side of caution when we're coming back. We're sensitive to make sure that all the individuals that someone's going to be coming into contact with also feel safe and secure, and having their children and working at the school as well. And so, and particularly in this early phase, where we're just starting to open up schools again, we're saying if it's new or worsening symptoms, then yes, we want you to go ahead and get that COVID test as well, so that we can be sure, and everyone else can be sure, that it's not COVID. We may be able to loosen that up as we continue through the tiers, but at least initially, as we're learning, and we've got kids we've got kids in indoor settings, we want to be extra careful. And at least initially, if it's not new or worsening, if it's new or worsening symptoms, then those are the ones that we'd want to make sure you get a negative test. And as we were talking about earlier with Dr. Vora's new health officer order, all of our clinicians should have that capability to do that testing.
That's right. And I know that Jeannie Prandini's team of nurses at all of our schools are a great resource for our parents. If they're not sure of any of this information, they can always call the school, and our school nurses will be a great resource. Something else I know.
Yeah, could I say one more thing about that, Dr. Farrell? Yeah. And we also don't want to put our nurses in the middle. And, this is serious stuff. I mean, we've got a pandemic on our hand. Over 200,000 people have died in this country. Over 7 million have been infected. And we're having our children and our teachers come back into an indoor setting, which we know there is inherently a little more risk. And so we've tried to put all of these steps in place to make it as safe as possible, with screening before they come in and checking temperatures, wearing face masks, and the social distancing, which are the foundation. But at the same time, we just want to be really careful when we start out. So if someone has any of those symptoms, we don't want to put a nurse in the position of having to sort out, well, is this your allergies or is this a symptom of COVID? I just don't think that's fair to our nurses. It's a difficult position to put our doctors in as well. And so we really are stressing the importance of getting that test for those symptoms initially. So as we gain more experience, we may be able to loosen up on that. But we've also added, if it's new or worsening, then that's a way that you can distinguish it. So if you have allergies every springtime, that's not new. Okay, but if it's we're really stressing trying to err on the side of caution, because we don't want to have problems. We really want the school reopening to be successful. We want to be as careful as possible. Clovis has done a great job of creating a strong online presence. So it's not, it does not lock you out of a good educational experience. Again, we want to be as safe as possible in this initial phase.
Thank you for that clarification. And then also we have some parents asking, you know, if we are granted the waiver, but the county goes back to purple, will we still be able to proceed with opening our schools under the waiver? Maybe one of you might be able to answer that question. Maybe Dr. Vora?
Sure. So with the waiver is really a concept that applies to the elementary school grades, so K through 6. And Clovis has submitted a waiver, and we're anticipating they did. If you haven't seen the packet, oh my gosh, it's fantastic. It's really well done, very complete, and we're anticipating that the state will approve that waiver. That waiver will allow the elementary school grades to go ahead and open for in-person instruction, regardless of whether Fresno County is in the purple tier or not. So that's the waiver. That can be confusing because the other grades are not included in that waiver application. And the other grades, meaning 7 through 12, will need to go ahead and wait until we're in the red tier for a full 2 weeks. And we're waiting to find out if we can go ahead and stay in the red tier. If we do go back into purple, then we're gonna have to wait until we cycle through and get back into the red tier, and then we'll wait that clock will start again for 7 through 12. So it depends on which grade you're talking about. The term waiver applies to elementary school grades. And then the red tier allows us to unlock and open the other grades for in-person instruction. Right now, we're really kind of unsure whether we're going to go back into the purple tier or not. We need to wait for the state to do their calculations and let us know, but we'll know by tomorrow. If we stay in the red, then 7 through 12 would be permitted to open. If we go back into purple, we'll have to wait until we go back into red, and then that 2-week time clock will start again. The state says you have to be in the red for 2 weeks before you can open up your 7 through 12 grades. I know that that's very confusing, and I probably didn't do a good job explaining it. I'm sorry.
Did, you know, for some of us who are living this on a daily basis, it's one thing, but for a lot of parents, they need to keep hearing it because they've got busy lives and they're trying to make all of these decisions. Another thing that our parents are asking is, has there been any data so far from other schools or preschools in the county that have already opened? Has there been any outbreaks? Parents are just asking. That might factor in with their decision making as they fill out our survey.
Thank you. Yeah, no, that's a great question. As we sit here today, I don't know of any outbreaks in the schools related to Fresno County that we have granted waivers for. But you have to remember that this process is only 2 or 3 weeks out. You know, our first waivers were granted about 10 days ago. And so the incubation period of this virus doesn't really start acting until you've been around other infected people for a couple of weeks. And so we anticipate if there are going to be, I mean, knock on wood, we don't want there to be any outbreaks, but it's still too early to tell. It's still just too early to tell whether some of the waivers that we've granted will result in increased cases and outbreaks. We're just hoping that these schools are all doing fantastic in terms of protecting everyone, screening everyone, spacing everyone, using masking. So, you know, all of that should come together to really guarantee that we won't have any outbreaks, but we haven't heard of any cases associated with the schools that we've had to do any investigations. So chances are those people are getting sent home if they develop any symptoms. And so that doesn't lead to any further exposure within the school. And we haven't heard about anybody having to shut down a classroom or test a whole classroom as of now.
Well, that is great news, and it's a testament to the fact that when we adhere to the protocols, you know, we can navigate this successfully. I did want to thank you for your compliment about our waiver submission. I just wanted to mention to all those watching that As required by the application process, our waiver is on our Closed Unified website. It's been on there since we submitted it on the Return to Campus section, right there on the front of our website. If any parents want to take a look at that, it's a very educational document. I encourage them to do so. Another question that's been coming in is, I think our community is quite excited to hear that Fresno State is starting to talk about football again. And we're just curious, how would that play into our return to play program, which all of our athletes have been participating in since June, actually, but with a kind of the constriction of strength and conditioning. Have you any news to report on how Fresno State's return to football might impact our return to play program?
It's a great question. We get that all the time. Of course, the higher education, the state developed different standards for that. And so they had standards that allowed for the universities like Fresno State, San Diego State, Cal, UCLA to be able to do this return to play for football and basketball. And there are very strict guidelines. I mean, they have to do testing on a regular basis, several times a week. They have not done the same for return to play for the high school sports. Believe me, we get that question every day, and we're always on the lookout. We've done the best we can with our conditioning because we felt it was very important, not only for the athletes, but for kids in general to be able to, even if they're like in youth sports, to be able to at least get outside and exercise a little bit, even with the physical distancing. We just recently updated our youth sport guidelines for the red tier to include sharing the ball. We have it by sport. And that's something that we thought was going to be very helpful to add some variety to the conditioning practices. But at this time, the state, we keep hearing there's going to be some more guidance coming out for return to sports at the youth side, but we have not seen anything specific at this time. Same goes for questions related to marching band and all that.
Right, yeah, and we appreciate that we've had what we have had. And we've been able to adhere to that. One last question before we kind of wrap it up for today is, we've had a couple of questions asking about masks versus face shields. Can you get, I know there's been some developments on that theory. I asked for one of you maybe to create or provide some clarification.
I can take a crack at that one. So the masks are what is considered the most effective way to prevent transmission of COVID. So it's mainly a respiratory illness. It's spread when we cough or we talk, and through airborne transmission, through respiratory droplets. So you can just imagine, how do you stop that? Well, you put something over your mouth, just like your mother told you from when you were a little kid, cover your mouth when you cough. And so the mask does that. Face shields are not as effective as that. And the CDC says it's not as effective. CDPH says it's not as effective. So the face masks are the preferred mechanism, and it benefits you to some degree, but it really helps others because it's really preventing you from spreading spreading the virus, and it does that very, very effectively, reducing the rates of transmissions by 50 to 70%. So probably the single most effective intervention that we have to prevent the transmission. Face shields help to some degree, but they're not as effective. You can just imagine you're holding something further away. There's more chances for the aerosols and the respiratory droplets to escape. So so the masks are the first line. If you're unable to wear a mask because you have a condition where that doesn't permit that, what we call a medical exemption, then the face shield would be what we would expect you to wear in lieu of the mask. So with both of those, in Dr. Vora's health officer order, it does state that if you have a medical exemption, you need to have that clarified by a healthcare provider. And they need to indicate what's the diagnosis that's the basis for that exemption. I know it's unfortunately, in my mind, it's very unfortunate how politicized the issue of masks have been. But I think just as a common sense approach, if you're worried about something coming out of your mouth, then you put a mask on, and there has clear benefit in terms of reducing the rates of transmission. So we don't want it to be a cavalier decision. and particularly when it's impacting other people. And when you're going to school, it impacts other people. So we've worked closely with the schools on the expectations around masks. If you're unable to wear a mask because you have a medical exemption, then you're expected to wear a face shield with drape.
And Superintendent O'Farrell, I just want to mention before we close today, one of the most common questions, I'm surprised we didn't get a question on this, is if I would send my child to school. I get that at a lot of meetings. I get it from friends. Absolutely. When we review these plans, we put in mind if my child was going through these steps to get to the school, and also our friends and family that are staff in schools. We keep that all in mind when we're reviewing these plans. So absolutely, I would have no problem sending my child to the school in Clovis Unified based on the guidance and the plans they have in place, knowing that nothing is 100%. Nothing is 100%. But if these are all implemented correctly and everybody's playing on the same page, let me tell you, there will not be any outbreaks. You may get a breakthrough case, but there will not be outbreaks if we're all playing on the same page. Thank you.
Thank you, David. And I just want to invite Dr. Vore, Dr. Zweifler, was there anything else that either of you would like to add about your interpretation of the safety of students to return to school at this point?
Just adding to David's comments, I'm actually a Clovis parent myself. My 6-year-old is a first grader at Fort Washington, and she's thriving doing the online learning, but we are very much supportive of the plan that's in place, and we look forward to hopefully getting her doing the in-person classes and meeting her classmates. So we're going through, I'm going through all of this together, both through the health department and also as a Clovis Unified parent myself.
That's great. Dr.
And yeah, and so we're in the field of public health. So public health is not just, even though it feels like it, it's not just COVID-19. There's a lot of other aspects. So as David Lucchini was mentioning earlier, we encourage kids to get regular exercise, eat a good, healthy diet, but mental health is a big part of it as well. And I think we've all just felt the kind of the oppressive aspect of living in a situation where you feel like you can't interact with others. So we think that psychosocial development, particularly for our students and children, is of particular importance. And so you have to weigh that. So we're trying to balance it. And I think we've come up with what I think is the best answer. So I really applaud Clovis Unified for developing a hybrid model that ensures social distancing, includes masks, and has with a strong online presence, so that kids have a chance to not only have access to in-person education in a safe, socially distanced manner, but also have continue to be educated online. And we just, we've been supportive. We as the health department have been supportive of bringing kids back when it's necessary. So for things like specialized classes or labs or special education situations, we don't want it the COVID to paralyze us, but we want to be safe about it. But we want to think about, how can we provide necessary services in a way that's safe and effective.
Well, and I just want to, as superintendent of the district and on behalf of our own governing board, I want to reiterate our commitment to implementing that plan with fidelity once approved. The safety of our kids is paramount, and as you said, it's physical safety and social emotional safety. So it's our number one issue that we're most concerned about right now. And I just want to remind all of our parents that survey was sent out last Friday. A couple of things: if for any reason a parent has not received a survey, please contact their school site principal, because there could be a contact information error. So we just want to make sure every parent has received it. Our parents will receive a reminder during the week, because it's very imperative that we receive all of the surveys back. And then I also want to remind our parents that we were very intentional with that survey, that in the email that they received, it had multiple layers of education. Referred our parents to our reopening plan, and we actually have a multitude of frequently asked questions on there, that many of their questions can be answered there. And this wonderful session with our health officers from Fresno County Department of Health is being recorded so that parents can access it later if they so need. So, you know, answering questions about health of our students is very important to us, which is why we're doing this today, which is why we have FAQs on our website. But any parent who comes up with any question that we haven't addressed, please call our principals, and we will do everything we can to assure our community that the safety of our students is paramount and that opening our schools safely is our intention. So with that, I just want to thank you all for carving out time to join us here in Clovis Unified today. Thank you for being arm in arm with us all along. And we look forward to continuing as we navigate these upcoming months safely with our students. Thank you, everybody. And thank you to all of our parents for joining us today.
Thank
Bye-bye.
you. Take
Okay.
care.
Bye.